Hi everyone. Today we will discuss about the Viva questions of solitary thyroid nodule. So when a patient comes to you with a thyroid swelling and on palpation, when you palpate the swelling, you palpate a single nodule. The Viva questions in the exam can be what are the differentials of the case. The differentials of the case are it can be a solitary thyroid nodule. So basically, solitary thyroid nodule is a generalized term. So you can say that it can be a solitary thyroid nodule in which it can be a benign nodule or a malignant nodule. So a benign nodule can be adenoma, it can be a colloid goiter, or it can be a carcinoma. So these are the main differentials of a single thyroid swelling. So the next Viva question can be what are the investigations in the case? You will investigate in this case by ultrasound, advising ultrasound neck. You will not ask just about that I will advise ultrasound swelling, but you will ask that I will advise the ultrasound next, because in ultrasound neck you can also comment on the if there are any palpable lymph nodes. So it can also show the other structures and palpable lymph nodes in the ultrasound neck. So the other investigations are thyroid function test and fine needle aspiration cytology. So basically in the Viva, if you say any term, you will have to justify it. If you say that I will advise ultrasound neck, then they will ask questions about the ultrasound neck, that what does ultrasound shows, and what is the classification, and what are different classification systems of ultrasound. So you will know each and everything about the ultrasound, importance of the ultrasound in thyroid. Ultrasound shows a swelling dimensions, whether it is cystic or solid, its echogenicity, margins, and calcifications. And it also guides FNAC. When ultrasound FNAC is guided by ultrasound, so it gives better details. The next important term is thyroids. They can ask you about what are the classification systems of ultrasound, thyroid ultrasound. So there are two classification systems. One is thyroids and other is U classification. So first we will discuss about the U classification, and then we will go to the more important classification, which is thyroid classification. So this is the U classification of thyroid swelling. It is classified into 5 subclasses, which are U1. In U1 the risk is normal and FNAC is not needed. In U2 the swelling is benign and FNAC is also not needed. In U3 the low intermediate risk of malignancy, so FNAC is needed. In U4 there is suspicion of malignancy and FNAC is needed. And the last one is U5, which is malignant, and FNAC is needed urgently in this case. So this is the U classification of thyroid swelling. The more important classification is thyroids. Okay, thyroid stands for what? It is Thyroid Imaging Reporting and Data System. So this is the thyroid classification, this one. So this picture shows you all the details of the thyroid classifications. So the subclasses are composition, echogenicity, shape, margins, and echogenic foci. So in all subclasses there are numbers which are given to different forms, and more numbers are given if there is suspicion of malignancy, and if there is not any suspicion of malignancy, so the number is 0. So in the composition, it can be on ultrasound a cystic swelling, a spongiform swelling, a mixed cystic solid, or solid swelling. So The most risk of the malignancy in it if the swelling is solid, and we will give it to 2 points. And what is the echogenicity? In echogenicity we will see the whether the swelling is hypoanechoic, hyper, or very hypo. If there is the swelling which is very hypoechoic, it gives the strongest suspicion of malignancy. If the swelling next is shape, if it is wider than taller, it is normal and benign. If it is taller than wide, then it gives the suspicion of malignancy, and it gives the 3 points in thyroid classification. Next is margins, which can be smooth, ill-defined, lobulated, or extrathyroidal extension. So next is echogenic foci, which are basically calcifications. It can be none, macro, peripheral, or punctate. Punctate points to strongest suspicion of malignancy, and it gives the point 3 points. Rim calcifications show 2 points, and macro calcifications show only 1 point. So next is the step is when we see all these things, then we will add all these numbers. And if on addition of all these number, the sum is 0, then the thyroid is 1 and it is a benign swelling. No FNAC is needed. And if the sum of all these factors is 2 points, it is TR2, thyroid 2, and it is also not suspicious and no FNAC needed. But if the addition of all these factors is 3 points, then it is mildly suspicious, and then we will see the size. If the swelling is more than 2.5 centimeter, we will go for FNAC. But if the swelling is more than 1.5 centimeter, we will only keep it on follow up. And if the sum of all these factors is 4 to 6 points, it is moderately suspicious of malignancy. And also, as it is shown that if it is swelling is more than 1.5 centimeter, we will go for FNAC. But if the sum of these points is 7 or more, then it is highly suggestive of malignancy. And in such cases mostly we will do FNAC. But if the swelling is very small, it is less than 1 centimeter or more than 0.5 centimeter, so we will keep it on follow up. But mostly we will go for FNAC in this case, because it is highly suspicious of malignancy. Okay, this is the thyroid classification of the thyroid swelling. Next, what does FNAC show? It it is most specific for thyroid swelling, and it gives an idea of differentiation between benign versus malignant swelling. So the FNAC classifications. What are the FNAC classifications? There are two most important classifications of FNAC, which are Thigh and Bethesda. And management of the swelling will be according to the classification. So this is all about the ultrasound and FNAC. And in the next video we will discuss about the Bethesda classification and Thigh classification of FNAC. Thank you.